we're going to be doing a general shoulder pain kinesiotaping technique. I have two pre-cut strips of tape here, Kinesiotape, and what I've done here is cut the pieces of tape so that it can start behind the shoulder and wrap down to the middle of that upper arm. I have two pieces, one that I'm going to do in the front and one in the back. And for reference, for length, it can go from the end of her shoulder down to her elbow is the length of tape I've cut. And I've cut two pieces and I've rounded the edges, which I do on all of my tape. How I'm going to start is I'm going to position her so that her posture is really, really good in the upper body. So shoulders are open and shoulder blades are squeezed together. How I'm going to start is I'm going to tear the paper backing about 1 inch from the end here, kind of like a Band-Aid. I'm going to make sure I fold this back here where I'm not touching the adhesive, just makes it easier to apply. Then I'm going to take off the paper backing of that end, a little anchor piece. I'm going to lay this on the back part of her shoulder, like so. So here's the bony bump at the end of her collarbone. I'm going to go behind that, and I'm going to lay that piece down at a little bit of an angle, just with no stretch. Then what I'm going to do is, as I lay this down, I'm going to peel back the paper backing, follow it with my other hand. Sorry, I know you can't see quite well there, but you're going to lay that down across the front of her shoulder. This is typically a very common area of pain. I'm going to go right over that area of pain at the front of that shoulder and then follow it down and lay that down with no stretch at the end. So really there's very little to no stretch on that piece of tape. For the second piece, I'm going to do the same shape but in the opposite direction. I'm going to tear off again the paper backing 1 inch away from the end. I'm going to peel off the paper backing without touching the adhesive. Now I'm going to put this on the front side of her shoulder. Again, I'm going to turn it at an angle so that it faces behind her a little bit. I'm going to start at the front part of her shoulder, kind of right where her pec attaches to her shoulder there. I'm going to lay that little anchor down on her skin, okay, right on the skin. And then I'm going to go toward the back of her shoulder and kind of behind it a little bit. And then I'm going to follow it around slowly. I'm going to cross over that first piece of tape, kind of right in the middle of that upper arm, and then lay down that last little piece on the skin with no tension, so that they crisscross each other in this shape here, okay? So again, we want to start on skin and end on skin. Even though the tape is crossing itself, we're not going to start or end on the tape, okay? So it's kind of encompasses the shoulder. I'm going to use the back of my hand to apply some friction to activate the adhesive on the tape. And this is great. Again, this is a general shoulder pain